Hello, everyone. Welcome to the CDAC Network webinar, The Rest and the West. This is where we look at how we can take learnings from the humanitarian response when it comes to community engagement and see how it can apply to what lessons can be learned and can it be applied to all citizens, including those in the West. And we are starting this about now. Before we start, I'd like to run through a few housekeeping announcements with you. And the first of all is we really do encourage you to send us your questions. This is an interactive panel, and we very much encourage you to send us your comments and your questions to the panel. When you do write your questions and comments, please use the chat function in Zoom, and please address it to panelists and attendees so that we can see it. So I look forward to hearing your questions and your comments. We also encourage you to share what you hear on social media. When you do that and you tweet, we just ask you just to use these hashtags at CDAC and hashtag CommerceAid so that we can keep track of this for people to see. And also, this webinar will be recorded so that you'll be able to share the webinar afterwards or review it back yourself when you hear things are interesting and you want to watch it back. It will be available on the CDAC YouTube channel. So I will now hand you over to a moderator for this panel, which is Sangeeta Maiska. She is a BBC presenter and news correspondent, and she works with positive thinking and solutions-based work. So I hand over now to Sangeeta Maiska.
Thank you so much. And thank you everyone for joining us this afternoon. We're looking forward to a really lively and engaging conversation. As Farman says, we can make it even more interesting with your thoughts and comments. We have a great panel for you this afternoon. We're going to be splitting this conversation up into 4 parts, and I thought it might be useful just to run through those with you so we know the direction of travel this afternoon. So we're going to start the discussion, which of course is based on Philip's work with the question, what are the benefits of community engagement when it comes to the COVID-19 response? We'll then be moving on to what factors limit the use of good accountability and engagement in the COVID-19 response. We'll then eventually move over to what happened to COVID-19 responses when accountability and engagement broke down. I think that's going to be particularly interesting and particularly on point because we're going to be tackling the issues of misinformation and disinformation. And then finally, we're going to end up, we hope, asking the panel for what they think the solutions are to the problems we very likely would have highlighted and deconstructed during the previous parts of the conversation. So we've got a lot to get through this afternoon, and so with no further ado, I'm going to start introducing you to our panel. Let me start then with Philip Taminga. He has over 25 years of experience in the humanitarian sector, ranging from managing community-based health programs to strategy and policy development and community engagement. Philip has worked with, amongst others, ICRC, CHS Alliance and UNICEF. He is now an independent consultant, an occasional CDAC expert and author of the paper that we are, of course, discussing today. That paper is called Improving the Response to COVID-19, Lessons from the Humanitarian Sector and Communication, Community Engagement and Participation. We're also lucky to have with us Gaia Gamhevige. Have I got that right, Gaia? First stab at it. She, of course, is the head of learning and capacity development for the WHO, a medical doctor by training. She has also been at various times a journalist, a community health director, and an academic. She now works for the WHO, where she helps countries to build a workforce and team able to manage health emergencies. For nearly 10 years, between 2009 and 2018, she was the WHO's global lead for risk communications, as well as leading capacity building efforts under the pandemic influenza preparedness framework. We also have with us Dylan Winder. He is the counsellor and team leader for humanitarian, protracted crises and migration for the United Kingdom's Government, Foreign, Commonwealth and Development Office, based at the UN in Geneva. He's been with the UK Government and was in development for 20 years, first in DFID and then its successor, the FCDO. Before his current role, Dylan has previously been the head of humanitarian policy and partnerships And before that, the head of UK Humanitarian Emergency Response. He also led country teams in the Middle East and in Central Asia. Finally, we have Kuroto Laiboni, an international development and human rights practitioner. She's a management consultant with FilmAid, providing oversight and strategic direction for operations in 2 refugee camps in Kenya. She's also a researcher, policy analyst and research fellow at the UK think tank, Chatham House. In her current work, she's involved with grassroots community engagement in refugee camps, as well as the campaign to look after Kenyan domestic workers stranded in the Middle East because of the COVID-19 pandemic. So let's kick off then this afternoon with section 1 of this conversation. What are the benefits of community engagement when it comes to the COVID-19 response? I'd like to, of course, start first with Philip, because it's your paper that we're going to be talking about this afternoon. I'd like you, if possible, to set out for us in summary what the aim of that paper was and outline your key conclusions for us.
Yes, thank you. Well, when CDAC began talking about doing this paper, I think it was like many different humanitarian crises where we want to take stock of what we've learned and identify good practices and make sure that we're doing that in a crisis situation. And so this was a kind of a typical lessons learned paper. But as I began researching this, I kept kind of contrasting that to what I was seeing and living in here in Spain, where I'm based right now, and in other Western wealthy countries. And basically the conclusion was, in fact, the humanitarian sector and many countries around the world that are grappling with humanitarian crises are already applying these good practices and these principles around communication, community engagement, participation. And so in fact, they seem to be applying those lessons. What was striking was that in countries like Spain or Canada and others, those types of lessons didn't seem to be at all in the public discourse, and certainly not in the way that government and health authorities were responding domestically to the COVID crisis. So the shift a little bit came at the realization that in fact there's probably a lot of lessons learned from the humanitarian sector that are equally applicable and relevant to all countries, but particularly for wealthy, higher income countries that are hard hit by this pandemic, but really need to reshift or reframe the way that they're responding in order to have more effective response. So the paper, basically I'm going to cut through maybe 4 key conclusions. And the first one is that people and principles come first, not politics. And what we've seen around the world is that in many different countries, different competing political interests have really diluted the response and got, in many cases, lost the focus that should be on who are the most vulnerable and affected people and communities. How do we address their specific needs in a holistic and integrated way? And how do we do that that's in a way that's principled, ethical, safe, and inclusive for them, using humanitarian principles like impartiality and non-discrimination. The second key message here is participation is key. This is a pandemic that is much bigger than any single government or country. It's well beyond the capacity of any Ministry of Health, and we can't tackle this kind of on our own. And the most effective tool that we have is engaging with civil society, engaging with people in communities, so that they can be part of the solution, and that they can really be the ones directing and telling government authorities and decision makers where the specific needs are and what the potential solutions could be. The third conclusion is this: transparent two-way communication is essential. We've seen that if there's no existing relationship and communication built on trust and respect, it's really difficult to get any population to listen what you need you want to communicate to them in terms of healthy behaviors. And if you don't have that two-way communication happening, people are not likely to listen to your messages, but more importantly, we or those of us in positions to make decisions aren't listening to the feedback and inputs from communities themselves. And that means the responses that we're designing and implementing are quite likely not going to be as effective as they could be. And we're probably going to miss out on identifying gaps and responding to all the different diverse needs of any population affected by a crisis, and in this case by COVID. And the fourth conclusion is we need to start taking preparedness seriously. We knew that this pandemic was going to happen. And when I talk about preparedness, it's not just about having the adequate medical supplies in place. It's about having the systems and processes in place to be able to respond effectively. And most importantly, is preparedness for how we're going to communicate with communities and people that are vulnerable and affected in ways that's going to help them to make better informed choices about how to protect and safeguard themselves and their families. It's about understanding what their trusted and preferred information sources are, how they prefer to participate and engage with aid providers and decision makers, what kind of ways that we can identify in advance, audiences that are likely to be left out, groups that are going to be left out of our messaging, and ways that they might be, the barriers that they might face in ways that we might overcome them for them to engage. And then the fifth kind of lesson for me in particular is that I think wealthier, high-income countries need a little less arrogance, a little less complacently, and a lot more humility. We think about countries in crisis all around the world, and then certainly in the Western world, we think, well, that's not going to happen to us. And there's so many lessons learned that we can get, not just from other countries, but from communities about how when they're engaged and when they participate and they have opportunities to provide their feedback and input, there's a lot of ways that they can work to improve the effectiveness of any of these responses. And we need to take a chapter from vulnerable communities and people around their own coping mechanism, their own resilience, and how by working together with government authorities and civil society and other actors, we could have a much more effective and efficient response.
Philip, thank you very much. Absolutely excellent summary. What I'd like to do now is move over to Gaia and Kirote, because actually I'd like to split that community engagement response into two parts. Now, Kirote, you've been working directly in a humanitarian response. What does community engagement look like, feel like, sound like in this crisis, in the COVID-19 crisis? And can you highlight some examples of best practice?
Thank you, Sangeeta. Before I answer your question, Sangeeta, I thought it would be interesting to share some statistics that speak to the heart of today's webinar that I came across while preparing for today's discussion, specifically on the financial support provided by the UK and European governments to Kenya's refugee operations. From what I came across, the UK government through FCDU, for instance, has a budget of about £10 million this financial year, running between April 2020 and May 2021, to support refugees here in Kenya. And of course, that includes not only access to basic services like health, but also awareness raising. So for me, this is a clear demonstration of the commitment that the UK government and of course the European governments as well have to in upholding humanitarian principles. But going back to your question about what community engagement means for us here at Fieldmate and indeed other agencies operating in Kakuma, which is where I'm calling in from, for us, it has entailed, and especially in the context of COVID-19, putting the communities at the center of our response. Firstly, in 4 key ways. Firstly, obviously, through identifying, information gaps and needs, doing rapid assessments to understand community perceptions as well. And obviously applying this information to produce multimedia and multilingual content on COVID-19. And this has been done in collaboration with not just the refugee and local communities in Kakuma and Dadaab, but also with various stakeholders that are very key to the operation, obviously including the national government representatives, the county government representatives, healthcare providers, and the UN agencies as well. Maybe just a bit of a context here. There are at least 12 nationalities represented here in Kakuma camp, population about 200,000. And of course, those 12 nationalities speak multiple languages. And so providing multimedia content on COVID-19 has been very, very critical to ensuring that we are preventing the spread of the disease. But beyond that, it is also very critical to then consider the way we disseminate this information to communities. And of course, we have to use the right channels, very key lesson learned here. And of course, using also trusted sources of information. In Kakuma, and of course, this also reflects across the country because the media landscape in Kenya is quite diverse. But in the operation, we found it very useful to leverage multiple channels of information, including obviously radio, which has a very wide reach here in Kakuma, SMS broadcast, because the mobile phone ownership is quite high in the refugee operation, and of course across the country as well. And public address systems, and of course, when targeting messaging for youth and children, also using posters and comic strips and other infographic materials. And then of course, lastly, and just to echo what Philip said, constantly engaging the community members, ensuring they are also given a platform to speak out through various means as well. Using interactive live radio shows, for instance, has been very, very impactful here in Kakuma. Organizing, small community meetings, and then conducting SMS surveys, not only to provide information, but also to collate feedback from communities. And going back to what I said earlier, then of course, applying this information and this feedback to disseminating the right content and the right information.
Yeah. So absolutely. Kirote, at the heart of this, as you say, is identifying gaps in information, making sure that those are thorough assessments, taking that information and turning it into a palatable way in which you can communicate with the people that you're setting out to help. Gaia, you've been involved in planning for a long time and responses. You've also been working with companies, as I understand it. How easy is it to take the kind of lessons that Kirote has just said she's been learning and then apply them in a context of commercial company?
Thank you, Sangeeta. I think I'd like to sort of add a couple of things as well. I mean, Philip talked about, why this is so important in COVID. I think just to add to that, we require human behavior change at a massive scale. But these humans live in very different contexts. So when you want behavior change, not just information dissemination, it requires not just engagement, because I think engagement is from us and them point of view. It's about participation of communities, right? And there's also massive social disruption. It's not just a health issue or a behavior change. We need collective, lockdowns, the way we travel, the way we buy food, everything has changed. And the scale and the scope and the diversity required makes it impossible to have an impact unless affected populations, also known as the whole planet, are participating. But of course, there's no one size fits all, right? So if you look at Kenya, if you look at the refugee camp, there is a big power deficit. There are people from 7 nationalities who are, if you like, being looked after, and we're trying to do community engagement and get information. If you take somebody in Oxford or Cambridge or even in downtown Colombo, where I come from, it's not the same because people are not used to that power differential. So I think this is very, very complex. But what can you take? What are the lessons you can take? Trust. Risk cannot be communicated unless there's trust. Unless we understand the context the community is in, and this is there are a million types of communities, what they value, not just the information they need, what they really value, how they learn, who they learn from. And Sangeeta, not just to link up to your question, yes, we're working with everybody and anybody because it's so complex. So, whether it's the service providers, I run a open learning platform. We have about 4.6 million people, including from Western countries, accessing basic information. But as Kiroti said, we have stuff in 44 local languages, but that's just a little bit of our delivery. We're not really addressing participation, and how people participate in London is very different to how people participate in Kinshasa. We are very different types of societies. In terms of companies, I found people really willing to give, not just come to us with commercial rates. So I just wanted to add that people really are collaborating, private sector, public sector, humanitarian development, in a way that I've not seen before.
It's interesting, you were saying that people communicate in very different ways. But the invention of the iPhone has been really quite a revolution in communication. And we're seeing it having seismic effects all over industries, including the media, in which I've worked for the last 20 years. What impact has something as simple as a phone had on being able to disseminate common messages? Because I absolutely take on board what you're saying. There are cultural differences, there are linguistic differences when trying to find information that you can then effectively package up and disseminate. Because you need to send the same messages around the world, don't you? Wash your hands, keep apart, wear a mask. Has this been a revolution? Has it been a help or a hindrance?
I think both. It has the potential. It's a tool. But what's really happening is we're telling people wash their hands. 40% of the world's population does not have access to water and soap. So we become irrelevant. So there is loss of trust, right? We're asking people to social distance. We're asking people to, wear masks. For months, there were no masks even for health workers. So in a way, this wonderful tool that has the potential, because it can't differentiate, right, to communities, it has become really, really difficult. And you mentioned infodemic, misinformation, disinformation. Actually, I think it has become more complex, and the age of messaging is dead. All right, the age of messaging is dead, that there is no generic message that you can take, because again, it doesn't recognize that when I'm giving a message, I am not on equal footing with the community. What we need to do is look at the science and work through intermediaries who are trusted by communities to see how that is understood, accepted, transformed. And at global level, this is an almost impossible task. The more local you are, the more you're going to get it right.
We're going to come back to quite a lot of the points that you've just raised here and are quite excited about. But before I get told off about talking too much, I'd like to bring Dylan in for a second, because actually, Kiroti raised up a really important point. She was talking about money and funding. Dylan, to what extent is there a bottom line element in all of this? Is community engagement cost effective? And if you think it is, how do you measure it?
Good question. So I think it is cost effective. First of all, thanks for the report. I think it's really useful to highlight the whole area around communication with people who are affected in West as well as in developing countries and humanitarian responses. I want to give you an example of where this didn't work. So we funded quite a lot of work in the DRC on Ebola. And to start with, in communities, the health workers went in full PPE to say, this is a terrible disease, don't get it, your biggest problem is Ebola. And of course, they just come out of a massacre and they have all sorts of other problems. So because we focus too much on these specifics around a health response, we created tension in the community, we undermined trust, and I think both Kiroti and Gaia have talked about that. And we basically didn't do very well on delivering for Ebola to start with. So I think actually understanding the context, working through community leaders who understand how the population works and what their community's priorities are, you're much more likely to have an impact, and you're much better able to manage this. So we call this whole area risk communication. So that's really a lot of the focus around this misinformation is about how do you manage risk that's caused by this. So of course, if you and what we believe is if you adopt these kind of approaches, this isn't just a set of activities. This delivers much better outcomes overall and much better results. So for the British taxpayer, for example, it's much better value for money to look at what people need, to provide more specifically what they need, to get feedback when people don't need stuff that they may be getting, and to course correct, than it is to just top down, pile everything in. And you're right, the context, and I think Kariti mentioned, the fact that we're in difficult times at the moment with aid budgets because our economies are all suffering. So it's really important that we therefore prioritize. And how do we prioritize our activities? We talk to the people who are in need. So, for example, one of the things we're really keen on is within humanitarian responses at country level, we're very keen that women's groups are involved in designing those responses. So, this could be for COVID, it could be for anything. So I think, we're convinced that by having participation by communities, by trusted leaders, understanding the context, you deliver better results and you save money.
How do you measure it?
How do you measure it? Well, that's difficult. But I think there was. I want to quote. I think it was Ground Truth Solutions did a bit of a survey probably a year or so ago now, looking at different types of communication and the impact that had. And I think they really back up all the previous panelists actually by saying people don't want passive communication. What they want is they want face-to-face. They want to be talking to leaders. They want trusted information. And what that study showed is that if you have those, you get better impact.
I'm just going to bring Philip in here because I can see him giggling away before we move on to the next.
He's probably involved in that study. I don't know.
Yeah, I can imagine. You really giggled actually and shook your head really quite violently, Philip, when you heard the phrase value for money. Would you like to tell us why?
Well, it goes back to this measurement question, and to a way, there's a bit of an obsession with measurement, even on healthcare and behavior change, and you look at how many people and we're measuring the wrong things.
But to be fair, as Dylan pointed out, the world's economy is collapsing, and taxpayers in wealthier countries want to know where their money is being spent and whether or not they're getting value.
Sure, and that's understandable, absolutely. But from the point of view of a community that's affected by any crisis, let alone COVID, the kinds of measures that we need to be doing more of are you satisfied that your voice was heard, that you had an opportunity to influence decisions? Did you have, are you satisfied with the quality of the assistance, or was the information about whether it's your rights or your entitlements or what you're able to access, are you satisfied with that? Those are the types of measurements that ought to be really, really the bottom line measurements for all of us, not what's the a cost for a radio spot or what's the cost for delivery of face masks. Those are important ones as well. But at the end of the day, it's the actual perceptions and experiences of people themselves. And just as a personal anecdote, here in Spain, no one bothered to ask me or my family or anyone else that I know, what do you think about the lockdown measures? How should we open schools? Should we keep your kids at home? How can we support you if you've lost your business? Those things affect me here in Spain just as much as they do in any other country of the world. Those are the types of measures that we have to start, questions we have to start asking, and the kind of measures that we need to be looking at when we're in terms of what we measure and what's important to measure.
And we're going to move on to talk about, really dig down into what those benefits are of that level of engagement, particularly in a pandemic like this, which is worldwide and has gone on now for coming up, well, it will probably come up to a year and potentially run into 2021. Dylan, we do have to move on to the next section, but I'm going to bring you in quickly. Please give us your response.
Just to say, I agree with Philip, but it's all of this. So we need to measure participation, we need to measure results, we need to understand context. So I think basically we need a very holistic approach. Preparedness is key because a lot of this takes time. If I'm responding to like the Typhoon Haiyan in the Philippines, which I did, there's not enough time to do a lot of this initially. So you have to be able to make some top-down decisions, but then you have to course correct over time. So I think what you need is this holistic approach. It's not one or the other, but it needs to include all the elements.
Let's move on now to the next part of the conversation, which appears to be this. You're all here agreeing that better communication, good accountability, good engagement has lots of benefits. You've eloquently told us what they are. Why then, if it's so brilliant, have Western governments failed to take these lessons on board? Guy, I'd like to come to you first. What thoughts do you have on that?
Okay, I've thought about this. No, because I'm from the East. I'm from Sri Lanka. I was born there. You know, I spent a decade in China. I grew up in London. I've lived in Switzerland for 20 years. So I'm really this sort of global migrant, and I've really looked at this. One of the ideas that can contribute to this, I think it was somebody, a professor I spoke to earlier this week, said to me about 1 billion people in the most developed countries are from more individualistic societies, right? Whereas about 6 billion come from more collective societies where we put emphasis on the collective good, the societal good. So, for example, when COVID broke out, I'm a Sri Lankan who's lived abroad for 40 years, right? But still, my social conditioning was my elderly mother lives with me. I must do everything and include everybody in the household, must be careful not to infect her. So I think, and a lot of scientists are talking about this difference in an individualist culture. So the most individualistic culture is the USA, but in the USA, those who live in the frontier, places are more individualistic than people who live in other places. And this, I think there is a social political viewpoint of the world where during an emergency where we need everybody just to conform, if you can wash your hands, if you can do this, this is not accepted in the same way. Now, because of this, there are community engagement and social networks are not so strong. If I go to DRC, Democratic Republic of Congo, I know I have to speak to religious leaders, community leaders, health work, the community health worker. I know who to talk to in order to access the community. Nobody in my Swiss neighborhood in Geneva knows how to access me. And Geneva is a place where they have direct democracy. We vote every few weeks on everything. So it's exactly the same as Philip. Nobody's going to really ask him. But actually, our standard for Congo is we should ask the community. But our standard here in the West is not. So I think there is something to do with the types of communities and the socialization and the political systems. So in China, when the government says, I'm going to lock down this city, they're able to lock it down. In democratic societies, this is not so easy, right? So there are social, political, economic barriers that prevent us from doing this. And finally, I think it's because, as Philip and others said, this community engagement, we saw it in humanitarian action as something we do for others, not something that we do for ourselves. There is a different standard. We are so enlightened. We don't need community engagement. We know what to do. We have information. We have smartphones. We have systems. So I think there's a combination. I really don't want to oversimplify it, but these are some of the reasons that I've been reflecting on.
I don't think you've oversimplified it at all, and I think you've raised some really crucial issues. I'd like to ask a slightly pugnacious question off the back of what Gaia has raised. And I suppose it's to Dylan, Philip, and Carota. I'd be interested in your view. When the pandemic, my experience, of course, is being a journalist here in the UK and experiencing the pandemic from that position. I do remember very clearly the earlier stories, January, February, stories started emerging from China and then Hong Kong and then Singapore, and the spread began. And there were accusations that began emerging here in the UK. I think, Dylan, you'll know about this, that there was a cultural and political attitude in the UK that Great Britain was somehow exceptional. And that term became known as exceptionalism, that we in this country, for some reason, and when I say we, I mean both parts of the population and the UK government and agencies working here, intergovernmental agencies, believed that somehow the things that were happening over there had absolutely nothing to do with us over here. And even if they did, Britain would somehow have a magical way in which it would deal with them these issues brilliantly and faster and better and more effectively than anyone else in the world. Dylan, do you think that's a fair reflection of some of the attitudes that we experience here in the UK? And if so, are you from Britain originally? I assume that you are.
Yeah, I'm from London.
Yeah.
I live in Geneva at the moment, I'm afraid.
That you recognise, and what impact, if anything, do you think that had on community engagement and COVID-19?
I mean, it's a challenging question. I think that well, I think what Gaia said is really critical. I mean, when I was in the UK, when I lived there before, I was a parish councillor, for example. Even as a parish councillor, I don't think we did community consultation. We may have had a few people that lobbied us to do stuff, but there wasn't really the structure there. I think had we done it, people might have thought we were sort of Big Brother trying to force them to do things. So I think there's a different cultural issue. But one of the things I think is interesting is if you look at how maybe more developing countries mirrored what we did in immediate lockdowns and things. Whereas when you look at the results of that, actually the secondary impacts of lockdown on things like gender-based violence, protection, loss of livelihoods, all of these things are massive in vulnerable countries. Whereas because they followed our model of looking very much at the sort of health response without thinking about their capacity and the issues to do with, well, not without thinking, they probably don't have the resources either. So I think, I think there is this, it's very easy for us to say we're exceptional and follow our model, and others may well follow that, but actually it's not necessarily the right one. So I think if one of the things I've learned from the pandemic is that, we don't necessarily have the sort of silver bullet in the UK for how everyone else should work. We may know ourselves. I think the discussion around the kind of social structures and individualistic societies is an important one to reflect on from a UK domestic perspective, but that's not my area. But from the developing world, I think there's probably things that the UK and others can learn from approaches that have been taken there.
What were you seeing on the ground in Kenya?
Just to build up on what Dylan has shared, and I think to respond to what Dr. Gaia said, that I found very profound, the fact that community engagement might be seen to be something that's done for others and not for ourselves. It's quite interesting to see, and I think one of the key issues that's being overlooked here within the humanitarian operation here in Kenya is engagement with humanitarian workers themselves and service providers, so including health workers, and actually just seeing them as a community in and of themselves. And what it's quite interesting to see. I think this is a missing link, actually. And it's quite interesting to hear just this morning that the infection rate, the COVID infection rate among humanitarian workers in Dadaab refugee camp in northeastern Kenya currently is much higher than among refugees. And that's obviously because humanitarian workers are moving around much more than the persons of concern. So I think the question to ask ourselves here is are there members of the public that we are overlooking while implementing this COVID-19 community engagement strategies?
Yeah, interesting you say that, because actually my next question was to Philip, which was interesting to hear you, Kirote, describing health workers as a community. You're absolutely right, we never think of them that way. But Philip, also in terms of minorities and women, who of course are not a minority, or 50% of the population, to what extent have minorities and women been properly engaged, do you think, during this pandemic? Yeah, over to you.
Well, I think the evidence is there that they haven't been, and that's just a replication of what normally happens anywhere. But even looking at Western governments, a lot of migrant groups were not considered at all in any of the support on any of the behavior change messaging on the support that is available, and the situation in the camp that Kirote is talking about is the same in many different communities in the United States or Canada or the UK. There are hundreds of different languages and dialects being spoken, and messaging is not recognizing that. Governments aren't recognizing that a lot of these groups have very specific needs and very specific vulnerabilities that a kind of one-size-fits-all approach is never going to work on anything, whether it's communications and social change behavior, or the types of assistance that they might need in terms of not being able to work or having to care for children. Those kind of dynamics are often just ignored. And of course, in the Western world, but also in other countries. I mean, there's not just countries facing humanitarian crises. We've got situations where groups have been facing stigma and discrimination and either racially motivated or not, and around COVID, but it's the same as HIV/AIDS previously or Ebola previously. So until we start to kind of recognize the diversity of groups and individuals within any community and start to adapt and adjust our responses, we're not going to be able to kind of respond more effectively, and we're likely to increase the vulnerability and the impact on these groups.
In terms of factors that have limited the use of good accountability and engagement, Philip, in your paper, you raise the issue of politics. Can you expand on that for us?
Well, I think, I mean, to go back to a bit of maybe what Gaia was saying, there's different kind of cultures and systems and processes in place. And I'm not so sure about this. I would maybe challenge this individualistic cultures versus collective culture. I think that's part of it. But I also look at the UK and this call for volunteers to help the National Health Service. And I look at the vibrant civil society organizations in places like Canada, the US, or the UK, or here in Spain, that are doing so much work to help marginalized and vulnerable communities in their own countries. And that, in a way, for me, that was a huge political decision of many governments not to look at that as a resource and not to use and leverage that knowledge and capacity of people and civil society organizations to respond. And that's in a way a political decision based on the kind of maybe the arrogance of from a technocrat perspective. We have systems and processes in place to do that. So that's a political decision on one side. The other more disturbing one, though, is the deliberate use of the pandemic to further political interests and political positions. And I mean, the things that kind of keep people safe in this pandemic, hand washing, face mask, and physical distancing are, absolutely low cost, effective interventions. And to have kind of in any country, any politician or interest group trying to kind of preach against that is just, it's atrocious. It's just not. And yet that's what happened in so many countries. Questioning the science, questioning the evidence, and using that as a leverage for political partisan gain is just simply not acceptable. And yet it happened over and over again in so many countries around the world. How do we get around that? Well, part of it is rebuilding trust in our institutions, and particularly public health institutions, about when they say this, that hand washing or using a face mask protects you and your family and your community. That message is understood and accepted and trusted. But when there's no trust, when you don't have a culture of engaging between authorities and communities in a way that people feel that they're listened to, that their concerns are heard, and that governments or health authorities communicate in ways that people can understand and accept, then you have the danger of politicization of this, and you have the danger of people manipulating a crisis to gain their own political gains and interests.
Guy, I saw you nodding away there as Philip was speaking. We can all think of a number of countries where health messaging has been kicked around as a political football, often with utterly tragic consequences. Guy, what do you think, what, if anything, can an organisation like yours do to help communities understand messaging, regardless of what their politicians are doing with that messaging?
So I think, you know, the one word answer is trust. and to keep building trust, you need to be relevant and being with people, not just during an emergency. You know, you need to be relevant throughout. These things that we're talking about are really complex, because the systems we're talking about, we need to prepare for and build, is really, you know, as Philip said, as Dylan said, you know, we need to look at who's there, what they're doing, and just engage them continuously. The participation of civil society in government is really, really important. I think this is the main thing. For WHO, of course, we're trying to, you know, just stick to the science, stick to you know, collaboration and getting countries and being very transparent about the results of research, the results of how the progress on the vaccines, on what we know. We do much more regular communications than we did, for example, in 2009. You know, there's a lot of information out there. We're working on you know, working with Facebook, working with others, really. So now Google, if you type in COVID, you know, we have an arrangement where the scientific information by our organization comes up high. So there are things you can do, but there's a whole lot of disenfranchised millions of people who won't even accept that. And fair enough, because there is so much manipulation of information. It's fair enough. You know, my mother and I go to YouTube and type in COVID, and she gets all of, you know, Trump is, you know, doing this, or Boris.
Keyword.
Yeah, you know, but I don't get any of that. I get, you know, WHO says that, because people are following your use of the internet. And it is, you know, I don't even know how to describe it, because I'm just a doctor. So I really think we have to be there, relevant, engaging people who are engaging communities. But Sangeeta, to your point earlier, there are virtual communities. Digital technology is really allowing us not to send messages, but also to work with people who are influential in digital communities. The UK, I mean, it has so many charitable organizations, right? They may not be working directly in COVID, but they have a connection with people, households and individuals. So I think it's long-term stakeholder collaboration, you know, building trust individually, but as institutions and in our processes, and really letting people, giving people, you know, easy access to science, and just keep doing it. I mean, in my organization, people ask me, what do you do if people criticize you? I say, well, that's a normal day at the office. That's okay. We have to just put our head down and keep doing what we are doing. But I really want to tell you, Sangeeta, you know, working where you know, in Kenya or in Sri Lanka, in rural Sri Lanka, is much easier, right? Because we are looking at communities that are geographically defined, even if they're not culturally defined. In today's world, you know, I belong to a professional community, a personal community, interest community, you know, some other community. So I think these complexities, we do have to work with the private sector, with digital technology. We have to look at that, because they are doing a much better job of finding people who will buy products and engaging and targeting them and building trust with them. Whereas for the most important commodity on this planet, which is health, we're not doing that. So, you know, I don't have a solution, but I would really look in that direction.
I'd like to just introduce some comments from those that are listening to us today. One from, I'm afraid I have no names actually. So somebody says, in the Kenya camps, they followed good practice, but the government was top down and didn't use it. Another comment, which I think is a fair point and actually brings me on to another question that I was about to ask. Can we stop just talking about messaging? Community engagement is more than just messaging. Actually, with that in mind, I was going to ask whether or not, I'd like to ask you about the mechanisms of community engagement. Have any of you come across during this pandemic really good examples of mechanisms for community engagement that have really been working, the lessons from which could have been applied in the West? Any suggestions? Not yet.
Yeah, I mean, I could start. I think it's exactly, you know, what we said before. It's countries which already are in which are connected socially, right? They already know who the community-based organizations are, the religious organizations, youth organizations, where there is a mechanism. So for example, in Sri Lanka, where all work is done that way because 60% of the population is still rural, it's much easier to do contact tracing, clinical management, community engagement, the full scope of things that is required for bringing a pandemic under control. But if you are in the middle of an emergency trying to establish that, that's a lot more harder. So I think the only way is to find out what is there, who is there, what are the networks, and engage with them. It's not about us as experts going to communities and engaging communities and telling people what to do. We are in a networked ecosystem. We cannot work in a linear way anymore. So I think those countries, particularly low and middle income countries, which have a tradition of community-based health and community development, are much, they're in a much better position. But as the comment says, even in those countries, in urban areas or in non-emergency areas, they may be using a completely different top-down, I am the authority, do this kind of approach. So it is somewhat complex. I think because context is important, it's very difficult to transplant these best practices as is, but we can take the principles and move them along.
Yeah, Philip, would you agree with that?
Yeah, I would, and I'd actually like to kind of point to my other panelists here about the experience of engaging communities directly in producing film or radio or things like that, where people actually have an opportunity to feel that they have something valuable or interesting to contribute. So go ahead, Nicarita.
Yes, thank you for the for highlighting that. I think it's a good strategy that Phil made here in both Kakuma and Dadaab refugee complexes uses even before the pandemic. Enhancing the skills of the refugees and the local communities to produce the content, the health content themselves. And of course, before the pandemic and during the pandemic, there have been other public health emergencies, recurring disease outbreaks like malaria and cholera. So it's been very important for us to continue producing and disseminating content alongside the communities that we serve, not only on COVID prevention, but also on malaria and cholera specifically.
Thank you. We have actually a really interesting question. Again, I'm sorry if you're in the audience and this is your question. I don't have your name, but a really great question. Will risk communication in a pandemic be effective without enforcement? So to what extent do governments have to, principally governments I assume, have to enforce risk communication in the pandemic? Gaia.
Gosh, my experience in emergencies tells me enforcement is really really the last resort, and it's basically a sign that really we have failed at everything. The international regulations gives us, there is law that sort of directs us as to what we can do, and quarantine of people who've been exposed can be. So if a country declares an emergency, they can in fact legally quarantine people, they can isolate the sick. So there are measures that are legal in nature, but are not ad hoc enforcements. Regardless of the type of politics, enforcement rarely works more than for a moment. And the backlash of enforcement is really, really difficult to even comprehend. And it is the opposite of engagement. Dylan, enforcement is the opposite of engagement. So
would you agree with that, Dylan? Is it a failure? Is it a sign of failure when a government would have to resort to enforcement?
I mean, I think so. I mean, I think what's more important is, so there's a couple of things from me. One of the really good things, and this is going back to the messaging point, but it's important, was that the Interagency Standing Committee coordinated the messaging between the Red Cross movement, WHO and UNICEF. So there were common messages. I mean, the challenge you have obviously in these places is you've got loads of different aid actors working. If everyone's delivering a different message, of course, that's as bad as not enforcing anything. So I think good coordination and agreeing amongst the actors a set of common messaging is really important. I think you have to use the science, but then if you look in the just watching the UK news, the number of people who don't want to take a vaccine, well, is that an enforcement issue? Is it a political issue? I don't know. But I wanted to also bring in another angle, which is those areas which aren't controlled by states. So I've been talking to NGOs in Geneva who work with non-state armed groups, and they've been trying to look at messaging around COVID in relation to international humanitarian law, for example, and how can COVID not legitimize non-state armed groups, but just get a better deal for those populations under those controls. Now it's been mixed, so some non-state armed groups have been using COVID as a way to sort of grab territory, but some see that actually this is important for their own standing within the communities that they control. Now we may or may not like non-state armed groups, but I think some of these lessons are quite important to learn and share, and that's not necessarily about enforcement, but it is about understanding who your audiences are.
Guys, I'm afraid I am running behind, so I'd like to move on to part 3 of this discussion, which is summed up, I suppose, with the question, what happened to COVID-19 responses when accountability and engagement breaks down, which is kind of the opposite end, I suppose, of what Dylan's saying there. Philip, we were told that COVID was a good time to use unconventional grassroots and social information. Did that happen? And if not, why not?
Well, I don't think it did happen to the extent that it could, and particularly in wealthier, higher income countries, it certainly seems abundantly apparent that it didn't, and as a result, I think you can see why we're having the second and third wave of infection in places like Spain or Italy or the UK or others. It was the lack of kind of engaging at an early stage with communities and kind of explaining why these measures were needed, making sure that there was legitimacy and trust. Come back to that trust word again, and because of that, you can see on the one hand that I don't think any Western country can claim that there's been a huge success and a model to follow for any other country, because the incidence rates keep going up in waves, and the inability to kind of have a clear, coherent strategy and engage with communities in a way that would help people to understand that this is a shared responsibility of all of us has been devastating. The other part of that, and certainly I seeing it here in Spain, but also in other countries, is when there's a breakdown in trust and there's misinformation and rumors and politicization, then you also run the risk of things like massive protests where none of these tried and true measures to contain the virus, like distancing and face masks, are used, and it just basically counterproductive to what we're aiming to do in terms of preventing, minimizing, and containing the spread of this virus. So the lack of engagement, the lack of participation, the lack of opportunities to feel kind of part of the solution, I think in some cases leads to people disengaging or protesting, and actually the level of frustration being such that it becomes even more difficult to do the job, to listen to the evidence and to try to create a shared sense of responsibility that we're all in this together. And if we don't work together on this, we're going to be in an even worse situation than we were at the start of this 6-9 months ago.
Do any of you have any thoughts on whether or not this has been a massively missed opportunity to use more unconventional grassroots and social information strategies? Do you think there's been a collective failure of imagination or innovation in this regard in terms of community engagement and participation? Dylan?
maybe just to come in, I don't know necessarily the answer to that question in the Western world. I'd be very interested to know, for example, what the British Red Cross have done in the UK. I think the Spanish Red Cross were probably quite active in National Society in Spain. So, and I know they will be doing quite a lot of this. So again, how much of this is visible? How much of this is just assumed because people know who their neighbours are, etc. So I think that's an important thing to look at. And maybe it's because it's not a formal sector, it's not a formal government, briefing the population every night to tell them what's going on. So I do think that we probably need to understand a bit better what these kind of organisations do. And then I wanted to just sort of give the example of Cox's Bazar, where in Bangladesh, where because aid workers were not allowed really to operate in Cox's Bazar because they didn't want to spread the disease, refugees actually took on a lot of the functions of the aid community, and did they did the messaging themselves. They through their own community structures. So in a way, COVID created a sort of bit of an well, I suppose it's a silver lining, but it empowered refugees to be able to do this themselves, because there weren't the aid workers in that camp then to do it in a way for them. So I think we should also look at some of the sort of what are the lessons of COVID that are maybe more positive and that will enable us to sort of keep this more localized approach in future responses.
Kirote, I was hoping that you may have examples of really good grassroots initiatives that would go to Dylan's point. Do you?
Thank you, Sangeeta. Yes, I think just to build on to what Dylan has shared, I think we've observed that in Kenya as well, that the manufacturing sector has been invigorated. We see more and more people, including here in the refugee camps, doing their own sanitizers, their own hand wash liquids, the soaps, so it's really created a more vibrant market, a local market. But the same thing to do with communications as well. We are seeing more and more refugees, and we see that within FieldMate, going out there and developing their own content, disseminating that content within their community structures. So I think COVID-19 has provided some opportunities to be innovative, but also to localize solutions more.
Brilliant. Can we stay with you, Kirote? I tell you what, there were accusations of information overload at the start of this pandemic. Is that something that you recognize, and what was done about it?
I wouldn't say there was information overload at the start of the pandemic, at least not in Kenya. I believe that the government, the Kenyan government, responded quite quickly, and it's quite commendable at how quickly the government responded, even before the first case was identified on March 12th here. And that is also reflected within the humanitarian sector. We saw a lot of interagency and stakeholder engagement and coordination, not only across the operation, but also with the national and county government representatives. So I think that the information that was provided initially was responsive to the need and the information gaps. And just to show you how effective that was, within a couple of weeks, by early April, some survey was done that actually highlighted that most Kenyans were aware at the time of the COVID-19 pandemic and just basic information about how it's transmitted as well. I think what has happened towards the end of the year now is we are seeing a bit of fatigue because, of course, there's been quite a number of changes, including in the mitigation measures, a lot of information going out there, but then also back to Dr. Gaya's response regarding or observation regarding trust, also increasing distrust as well. So I think towards the end of the year, we're seeing that.
So Dr. Gaya, could you touch on these two issues? Did you ever see information of did you ever see evidence of an infodemic, a kind of information overload? And then going to Kiroto's point, do you think there's now information fatigue where people simply can't take in anymore and don't want to take in anymore?
Yeah, I mean, objectively, there is more information out there. So, I mean, this whole term called infodemic is trying to capture that. There is a lot out there, but it doesn't mean it gets to the right people at the right time. And it's more difficult for people to discern. If we look at, the last pandemic, 2009, you had very clearly one or two points of information right? And everybody sort of, it was like the 50s where we all huddle around one TV set. Here in the same household, the same information is being curated because of, smartphones in different ways. So I think there is information overload. I think that it is difficult for people to figure out what is true or not. So what they do, and a lot of studies show this, they go to the sources they trust, even if it's not accurate. So I think, this is a human behavior. It's not a technical behavior. It doesn't matter in WHO, we say here is the scientific evidence, especially when we're under threat, risk like this, people perceive risk in a different way. They go deep into the brain, into more ancient forms of quick decision making. I'm under threat. I will take this because I trust this source. And neuroscience is telling us how people perceive risk. And it's regardless of levels of education. It's not about knowledge or information. It's about trust and perception. And of course, there's fatigue. I mean, there's fatigue, even if it's not about information. People are fatigued because of the economic, the loss, the economic inactivity, the loss of travel, not being able to see friends. And you will see as the year ends, the number of people actually complying with public health advice, I think, will go down. I think when the vaccine comes, it'll be even more confusing because some people will take it, some people won't take it, others will have it, others won't have it. So then, there is a scenario, people will say, well, none of this matters, let's do nothing. So I think there is a really dangerous period coming ahead of us. But I wanted to also, Sangeeta, point out to the previous point, for the first time ever in a global pandemic response strategy, we had risk communication and community engagement as a response pillar. We've never had this before, okay? 68 of the most vulnerable countries, 80% of them are tracking progress on risk communication, community engagement. Definitely they're not high income countries, I agree. So there is a big shift. I mean, I don't want to be all gloom and doom. We have progressed so much. I spent 30 years in emergencies, right? And we have progressed so much. But we have to remember all emergency preparedness is usually done in the health sector for health emergencies, but politicians will take the lead in any emergency. And this is a lesson we have not learned. It is not for us to say or have people politicize. Of course, people will always politicize an emergency. An emergency is just too rich to let pass, okay? But it's for us to understand this. And I have spent many decades training people in the health sector, only to see people who are nothing to do with humanitarian or health or development taking the lead and taking decisions, because that's what people do when their country is threatened. So I think there is a great opportunity for us to do this intersectoral work, multi-level work, listening to each other. I think we've achieved a great deal. We're on the brink of getting a vaccine that's safe and effective in record time. This is through collaboration of scientists, of countries. It's an unprecedented time as well. I mean, COVID-19 has shown what we can do. But of course, we have to shift our mindset and really move forward in a much more diverse way.
I mean, Guy, you talked about the vaccine there and how in super quick time with scientists working together all around the world, we have never seen this, actually. And it is a great testament to humanity, right? Having said that, I absolutely take on board your points about human behavior and how human beings behave when they are threatened and put at risk. But there are more malign forces at work as well. There is evidence that there are international governments that are deliberately putting out misinformation, disinformation with regard to a number of issues, but including COVID-19, conspiracy theories, making sure that that misinformation and disinformation is propelled at record time around the world. What impact is that having on community engagement and participation? Is that level of interference actually the greatest enemy of community engagement and participation right now? Philip, I'm going to throw that humdinger of a question at you. And then Dylan, it's you next because you smiled. Go.
Keep the smiles off your face. I mean, I don't know if that's the biggest obstacle to community engagement. I just, drawing on my own experience, and Dylan mentioned the Red Cross, and that's where I started, in the Canadian Red Cross, and then worked in Central America on community health programs. And I think the closer that you get to communities, and the longer that you are engaging with them, the more likely you have something to counterbalance the other sources of information and maybe manipulation that's coming from other places. And you said about it, innovations or not. I mean, this is tried and true. The Center for Disease Control in the United States is a huge champion and has so many positive experiences around how, when you engage with vulnerable and marginalized or disenfranchised communities, along with health authorities, along with civil society or volunteer organizations like the Red Cross or faith-based organizations or whatever it might be, there's so much you can achieve, not just in terms of health outcomes, but also just in general, in all the different dimensions of people's vulnerabilities and addressing their needs. So again, it's hard to get us past that, particularly in kind of Western high-income countries where we've placed a lot of emphasis on sophisticated systems and processes and bureaucracies that work largely, for the most part, until something like this comes along. And that's when you really note that disengagement or that lack of connection between, for example, very sophisticated health systems like hospitals and your primary health, nurses and doctors at the front line in a community, and the volunteers of organizations like Caritas or the Red Cross in the UK, where that's where you see the disconnect. And unless we start to recover what we used to do, at least years ago, in terms of making sure those different systems, informal and formal, start linking up, then I can't, then I think we're going to be liable to manipulation and distortion and disinformation, because in the absence of that engagement, in the absence of opportunities for participation, that's what you're left with. You look for whatever you can to fill those gaps. And so it's again, it's a shared responsibility. I mean, I always want to stress this again. It's not just the Ministry of Health anywhere's responsibility to deal with this pandemic. It's individuals as well, taking responsibility and being part of that solution. It's civil society organizations, it's businesses, all of us have to work together in a more joined up way. So I don't know if that's an insurmountable task, but I think there's enough examples from the past and the present to show us that it is possible to do.
Dylan, do you have any thoughts?
So I think generally if you look at humanitarian work, we're sold on the idea. For the UK government, it's one of our top 4 priorities for engaging in this space. We recognise, as I said at the beginning, that you get much better outcomes for people if you engage them, and you reach disadvantaged groups. You can reach people with mental health issues that you might not spot. You can reach people who have disability. You can reach maybe sort of child trafficking type thing. So we know that engaging with communities in humanitarian responses is really critical and really important. I think we've got lots of evidence from Ebola and now from COVID, and we should add those to the toolkit. I think and of course it's easier to do that because in a way through funding, we are funding the UN, NGOs, the Red Cross to do this. So we can say we want you to prioritize this in the work you're doing in these 30 countries. But if you go to the West, I remember when we first had the refugee crisis in Greece, there wasn't a UNHCR really in Greece that could help the Greek authorities manage the refugee response. And when UNHCR did come in, there would have been a discussion about, well, who has the, who is the kind of more important here, the national sovereign government or a UN agency? So I think in the West, we don't have the infrastructure, the UN agencies, all of those things really that are coming in with a set of ideas that are based on this sort of broad evidence. And we also don't have, you know, the same sort of cultural issues. I mean, I think as I think it was a guy who said at the beginning, you know, you were thinking, or perhaps it was you, Sangeeta, thinking about your mother. Well, you know, if I take my hat off here and I'm in the UK, I'll be thinking about my immediate family. I won't be thinking, oh my gosh, I must look out for the local government plan to engage with to sort of help that, you know, develop. So I think there's a mindset of just thinking, well, someone else is going to do that. I don't need to do that. That's Department of Health. That's why I pay my taxes. Whereas I think for humanitarian crises, people are very vulnerable anyway. They have communities because they're living in these very vulnerable situations. They need to work together. They're less reliant on state services because in many places these don't exist. And so you have a very different culture. So I guess my conclusion is, you know, we need to learn the lessons in the West, but actually I think in humanitarian context, this idea of trust, engagement, and community empowerment is sold, but we need to get better at doing it. And I do think that some of the top-down planning that we see at country level, we need to make sure that women's groups are involved in those, disabled organisations are involved in it, etc. So that's my rather long-winded answer.
No, and it was a very good answer because it's actually answered the last question that I was about to ask all of you. So Dylan, I think I might just give you a free pass on this. What could be done differently? Actually, Philip, let me come to you, in fact, first, and then come to Gaia and Kirote. If we were to follow humanitarian best practice for community communication, accountability and engagement, can we resolve, do you think, a lot of the problems that have been raised during this discussion? Could those lessons be applied here in the West? I suppose I'm asking you the answer in your paper, really. What are your thoughts?
Well, that's essentially the main kind of conclusion of the paper. And if you look at humanitarian principles, which are developed, you know, over now 150 years or so, it's about putting people at the center, considering them kind of in a holistic way, and engaging with them to understand all of their diverse needs and vulnerabilities and their capacities and resources. And to do that and focus, you know, laser focus on that, then start to, you know, think about, well, how do we build that out in a more effective way? And the way to do that is again, having clear, deliberate strategies about how we're going to engage with communities, how we're going to communicate with them and how they can communicate with us, and giving them opportunities to participate in decisions that affect them. Those are, you know, the kind of the key lessons that over 150 years of humanitarian action around the world has shown in any type of emergency, whether it's health or a disaster or a conflict. So I think applying those principles and going back to that first point, keep the politics out of this. Focus on what the needs are, understanding them, and engage with communities in ways that help minimize the risks to them and help maximize the outcomes for them. That's what we've learned from humanitarian action. And if we'd applied that kind of more systematically in many higher income Western countries, I think we would have reduced the impact significantly. If we apply them now and we continue to work on that, we'd be better prepared for either the next wave of this pandemic or for any kind of future emergency.
Dr. Gaia, I'm going to take a guess. I suspect your answer to better community communication, accountability and engagement is going to be trust, building trust. Is that right?
I think so, but I honestly believe the participation part of the recommendations is what we should focus on. I still find community engagement in humanitarian settings, really it's communications masquerading as engagement. So I think in the humanitarian community, we have to be honest and to say we should also improve it there, right? So it's not everything is working there. Let's be really honest here. Then secondly, we should look much more about participation, because in high income countries, people often have access to information. They don't need communication, right? We engage communities not just to address vulnerabilities and marginalized groups, but we have to acknowledge we don't have the total knowledge required to address this challenge in this situation. That's the point of it. That's why participation, co-creation of solutions, ownership, accountability by the community is the most important. So yes, if we are sticking to that end of the spectrum of community engagement, absolutely. If we're going to give it lip service and do a little bit more sophisticated communications, absolutely not. And really understand why. It's the humility to say we don't have the answers in this context, right? So that's really important. And that's why in my career, I'm shifting much more to figuring out how communities learn, not how we can tell community. How do they learn? What do they value? Who do they value it from? And how do they want to learn? And I think the key to it is to evolve community engagement, the way we do it in humanitarian situations, and push it a little bit more to meet the needs of more informed communities who have much better access to basic information. So yes, but with a reservation.
Kirote, finally to you, what can be done better and how?
Thank you. Maybe I'll begin by highlighting one thing that we haven't talked about today is the fact that information provision and community engagement has to go hand in hand with service provision. So we cannot provide information, we cannot engage communities on public health issues like COVID-19 or malaria or cholera without providing the right services. So if you want to address malaria prevention in Kakuma, for instance, and you're not providing mosquito nets, then what you do is you create an environment where you create demand for services, but then you're not providing those services, which actually has an impact on the communication. I think beyond that also is just building on to some of the things that both Philip and Dr. Gaya have said. Solutions need to be context specific. And of course, this looks at languages. We've talked about ensuring that the communication is in the languages that the public actually fully understands, and especially in countries like Kenya, where we have over 30 languages spoken in the country. But then also looking at different channels of communication. For instance, now in the education sector, we've had students having to study from home, but not every Kenyan household has access to the internet. And so one of the things that actually has worked quite well here is adapting the national curriculum learning material into radio learning classes to ensure that this is accessible to children across the country, especially those who don't have access to laptops or computers and the internet. I think building up onto what Philip said as well, planning well and planning early. So it's not just enough to, of course, be prepared even before the pandemic hits. I think I'll leave it at that. Thank you, Sangeeta.
No, thank you very much. And I'm afraid our time is nearly over. Philip, Dylan, Dr. Gaya and Kirote, thank you so much for spending the afternoon with us. It was a lively, informative discussion. I hope you've enjoyed it as much as I have. It's now my chance to hand back to Phan Man Sang. Thank you very much for putting up with me. Phan Man, over to you.
Thank you very much. And thank you for joining us. We'd just like to remind everyone that this has been recorded. So I just say that it's recorded, and if you would like to view this back, it would be available for viewing. And so that is available for viewing. When to be recorded, it should be available in the next few days on the CDAC website. So if you would like to view this, and please share, and please comment on what you've heard today on the using our hashtags, as you can see on the screen. So thank you very much for attending. We hope you found it informative, and we thank you. Have a good day from the CDAC network.